Nigeria and indeed the world is yet to be freed from the grip of the ravaging COVID-19 pandemic. In the last 2 days, Lagos recorded about 519 COVID-19 cases and 6 deaths, rising fear as the government struggles to deal with the more dangerous Delta variant amid this mounting anxiety. 16,000 resident doctors under the aegis of the National Association of Resident Doctors, NARD, commenced a nationwide strike this Monday over unpaid salaries and benefits to families of members that lost their lives to the pandemic, as well as hazard allowances. Actually, there's a misconception even stemming from Lagos State, because the Commissioner for Establishment came out with a press release yesterday and the Prime said to deny it, that this NYC doctors, training doctors, resident doctors, that there's a rumor that went around that from 75,000 that the government want to cut their money to 15,000, and they've denied it, that there's nothing like that. Let's start from down.
Well, don't also forget that these issues are affect all the states. They're just bringing them together. For example, when they are talking about irregular payment of salary and deductions, they are referring to some states.
Okay.
I think the other day they were talking about Abia, saying that
Abia
doctors were being owed many months' salary in the state-owned teaching hospital.
That's Dr. Upazu.
Yes. So, and what they want to see is a situation in which all of these problems can be addressed together. So it's possible that Lagos does not have a problem, but that some states are suffering from it. Just as we've seen now that, look, some states don't have a big COVID problem, but in Lagos is approaching something big again, for which everyone has to be careful. If we can move in 2 days to in excess of 500 new cases,
And it's more devastating.
then that's why I thought that we are not testing enough. Then we have to be careful. If inbound passengers are evading quarantine and they are getting away with it, then we all should be worried. And to compound matters, this is happening at a time when resident doctors have decided to go on strike again. They are saying that they lost 19 of their colleagues, and that government has not even paid, they lost them to COVID-19. You know?
Everything 19.
Yes. Now, government has not paid the entitlements
Of
those doctors to their families. How do you encourage people to put their lives on the line? These people are the first responders. They are the front line.
If you watch CNN, if you watch BBC, they celebrate them abroad.
You need to see, yes, all those,
they celebrate them.
the NHIS or what they call these guys in the UK. The public health practitioners in the UK. They celebrate them, they hail them, you know.
They're like heroes.
They like them. Yes, they are heroes. People put their lives on the line so that you can be saved. Yeah. They can't be called anything apart from heroes. Now, it's since 1991, we have not increased hazard allowance of doctors. It's still 5,000.
5,000. That's ridiculous.
This is for 5,000 that you put your life on the line.
Yes.
To save other people.
It's not realistic.
The truth is, if since April 10, government said, okay, we are going to, let's have a memorandum of agreement. You are going to do this, you are going to do that, you are going to do this. And immediately the memorandum of agreement was signed, everyone went to sleep. You are now surprised that they are back. That's right. That's not good. Do something, approach, come to the middle. If you can't do all of these things, don't make promises that you can't fulfill. That was what the Senate president warned them about. He said, we see clearly that you make promises that you can't fulfill. Promises that there's no cash backing for.
Yep.
So now, come to these people, tell them, look, for now, admit with us, we can do these 5 out of your 10
Don't just say you want to discard them,
because
post them.
These guys are not fools. They suspended the strike that time. They didn't call it off, which means that they can resume the strike without even notifying you.
Yes, exactly.
That's what it means, and that's what what they have done now.
Doctor, I think this is kind of insensitive. If 16,000 resident doctors doing in between a pandemic,
it's well, sometimes I don't even know what to say, because like BQ said, you've brought people together. April, May, June, July. 3 months after, and we are still on the same spot. These people are saying, see, you made promises and you can't fulfill them. That is why sometimes I say to people, I'll prefer somebody like the Speaker of the House of Representatives, Femi Gbajabiamila, negotiating on behalf of the federal government, because he says it straight to most of these people who go to visit him. You are asking for this, and this, but the economy cannot take it now. These are guys go to the negotiating table.
Stop giving them false hope.
Let them know
that we'll do it. Don't worry.
We're going to do it. No.
And when you get to that time,
the one that I feel should be quickly addressed is this issue of the hazard allowance. How do you pay a man 5,000 naira? Even I won't take it. Sitting in my room to be working for somebody and you are paying me 5,000.
Risking my life.
Risking my life for you. We should be factual.
19 of them are dead.
Well, most companies, they work from home now.
We should be factual when we are negotiating.
They must be physically...
Say it as it is. Let them know. See, this is what we have in the budget. Except we are going to make the country collapse. These are the things that are possible now. Not that you just go, sign an agreement which you know, as you are signing it, that you are not going to fulfill. It's a dangerous trend.
You know, the painful thing is that government even promised to increase the thing.
Yes.
And you said, okay, so percent of the basic salary, I think maybe 30% or so, I'm not sure, of basic salary is what you will now get as that allowance. Then since that time, they've been waiting. Pay this thing now.
Don't forget the brain drain in that industry. They're all going to Australia, going to UK, going to in Saudi Arabia now. No, those are trained doctor, $5,000.
They know that we have very capable health practitioners, even dentists. They are in short supply in other places. If you can go to the UK and other places, they'll be happy to receive you. Go to Canada. They need laborers in a lot of those places.
Even when you look at what is happening at the Olympics, you see Nigerians competing with other countries.
And defeating fellow Nigerians. These are our own children.
These are people we brought up here. Our own names. And then we've seen...
You don't sign a memorandum of action. You don't call it memorandum of action when there is no plan to fulfill it. When you do that, you make it look like you are taking them for granted. Since April 10, what have we been doing? It's the same attitude to ASU.
And ASU is going to strike again.
Yes, and you know, even consultants too, they've served a 21-day notice, ultimatum. No, consultants. No, these residents also are their juniors. Yes, consultants too. They are already threatening that they too will take action. So how can we have a health sector where people are at the risk of not providing service at a critical time like this? Okay. When we have cholera has killed almost 600 Nigerians. Then we have
shameful.
Yes, even Abuja is one of the highest.
It's involved.
It's one of the highest.
You are talking of cholera. You are talking of
and we have COVID.
Adegoke is calling us from Niger State.
Good evening.
Good evening, okay.
Yeah, Babajide Kolade Ojitoju. I'm very lucky this evening to have been online.
Thanks.
I've been trying you over 3 months.
Wow.
My
devoted your time.
To Ayotu and Mr. Oladipo.
Yes.
My contribution goes to that Ajuwon Akute Road. In fact, it's very, very bad. Very, very bad. From Alagbole down to what's it called? So Akute, is a terrible road. In fact, I have so many friends that because of the road, they park away from that side to like Ododo to other areas. So you guys are doing very good job. But if you can really tell whoever is in charge, we will really appreciate. Thank you very much.
Thank you.
Thank you.
Very,
We have to go. We don't have the time.
Thanks. Yes, as I was saying, that hazard allowance around 30%. It's actually 33% of basic salary. But implementation has not happened. If people are saying they are being owed salary, implement, and you agreed, implement. That's the only way we can avoid all of this wahala in the health sector.
Okay.
And you know, finally, at my own end, I believe that even the budget to the health sector at state and federal level has to be increased. A situation in which we are dedicating just 4% of our budget to health. We need to look at even the countries around us. That's why they are doing better.
Health.
That's why they are doing better. We need to 4%.
That's why
That's why you can't find money. You can't raise enough money to take care of the problems in the sector. It's just too low.
All right.